right? And qu'est-ce qu'il y a? Oh, oui, 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 oui. She has to close the eyes, of course. Bon, alors, camera one, maybe. Just to show, and zoom on the camera one, just to show where I put the injection point. So, I pinch the skin. Zoomez un peu plus, s'il vous plaît. OK. On y va? Allez, respirez bien, tranquille. Voilà. OK, down to the ball. On commence à injecter. Tournez un peu la tête vers moi.
You are with XL or double XL?
This is XL with the lidocaine. I can use, of course, the double XL, but I think she doesn't need too much projection.
But
Okay.
in some case, it happens to you to use it.
I use it a lot, double XL. But on that case, because vous avez un peu mal. Hein?
Harvey, didactically, you touch the bone and you move a little bit forward then, or you just stay close to the shoe?
When I was starting, I was touching the bone, but it is painful. So now I know I'm deep enough. I feel the resistance.
Okay.
I know I'm deep enough, so I don't touch the bone. Sur une échelle de from 0 to 10 on the scale of pain, how much is the pain? 1? No.
Be sincere.
No. Tell me the truth. So, really? Okay. Tournez un peu la tête là. Voilà. Et centrez l'image. Voilà. You see
Mine normally are crying at this point.
she's crying, but she's because she's very happy. Okay, so now I stop. I look at the profile. You see the profile? You see the projection already? So I change completely her angle. Regardez. Voilà. Vous avez vu? Super. And now, so I use the cap. Fermez vos yeux. Close your eyes. Closez vos yeux. So I bend this needle on the cap, on the sterile cap. I'll take the same entry point, antiseptic, gauze. Voilà. Attendez, donnez-lui une petite compresse sèche. Tenez, essuyez vos yeux. Je ne veux pas vous faire pleurer. Voilà. Okay. So I already use 0.4 ml. En bas. Okay. Nasal spine. And now I go up to the columelle like this. Okay. So I go to the same entry point here. Okay. I start to inject immediately. Vous sentez rien. Of course, it's numb. She said, I don't feel anything because it's numb. Okay. Voilà. And I stay very medial. And what I want to see, you to see, maybe camera one, please. And zoom on the camera one. Voilà. Zoom on the camera one. Voilà. What I want you to look is this triangle. And I'm doing voilà, the tip projection. Ça va? Okay. In between those two cartilages, I have nothing dangerous. It's just fibrotic tissue. Okay, I control also on the profile. You see the tip projection and also the triangle. I'm pushing the two alar cartilages. Ça va? Toujours? Okay, vous sentez plus rien là? Okay. So camera 2. Voilà. Okay. So I'm using, so it was 0.4, and now it's 0.8. So I use 0.4 and 0.4, roughly. Voilà. Camera 1. Voilà. So I didn't change the shape, but this is more delicate. You see the triangle and these two projection. And the nose is more, she has more elegant face, even if you see a little bit the nostril. Okay, camera 2. Voilà, okay. So now we go to the dorsum. Voilà. So I was on the right side, I moved to the left side. Maybe we can stay on camera. Okay, maybe camera 1 just to show you where I put the needle. And then we move to camera 2. Alors, one trick is, you fermez vos yeux, pinch the skin, so to distract the attention from the patient. You go down to the bone. Okay, and now camera 2. Okay, tournez un petit peu. Voilà, normally, of course, I don't turn the head of my patient. Okay, ça va? Okay. So here is 0.2 ml that remain in my syringe. Voilà. There is a little depression here, so I move from there. Ça fait mal. Because I was too fast and I didn't inject. Voilà. Camera 1, I want to see the front view. What is important also is not to over-inject here and not to get the gel falling down here. And you had an injection a year ago or two, and the gel came down here. Okay, so we don't know which gel, but and we don't tell which gel, by the way. Vous pouvez me tenir ça et rester là, s'il vous plaît. So now I do a molding. You see my fingers. I create. Camera 1. I create this shape, it's like a rectangle. Because I want to shape that. Zoomez un petit peu, s'il vous plaît. Voilà. 2 fingers lateral, 1 medial. It's like a rectangle. And I want to just create this tiny projection here. And now, because this is like a normal life, I don't want to inject 2 or 3 syringes on her nose. I have this 0.1 ml. What do you think? Shall I inject? Attendez. Shall I inject on the supratip or more on the dorsum? Caméra 2, pardon. Je vais tourner la tête comme un malade. I think the nasofrontal angle and the dorsum is smooth enough. Zoomez un petit peu. Voilà, I think she needs a little bit. We like on surgery, we like this, what we call the double break. This is 1 break and a double break, but I think she needs something here. Regardez, le nez vous plaît ou vous voulez que je corrige un peu ce petit creux-là? Voilà, okay, so I ask the patient. Voilà. Of course, surgeon, we are God, but God listen to, à ses ouailles, hein, to the believers. Voilà, so camera 1, just to show, tournez la tête, excusez-moi, vers là, vers moi. Attends. Okay, and this is 0.1. So here I'm not that deep. I'm subdermal. Voilà, because she said because I'm more subdermal. I don't need to go too deep there. Voilà. And what is important? You look at the color of the skin, and you look when it's a bit painful. Of course, you have to stop. And the severe pain with bleaching, you stop immediately and you use hyaluronidase. No choice. You don't think, you just use. I have a hyaluronidase in my office, in the fridge, ready and mixed. Alors, faites voir le profil là. Okay. So now I do a bit of molding.
Yes, it's great, Hervé. Very
Voilà.
nice.
Okay. So